Good afternoon, everyone. My name is Hendrik van Rijk. I am a board member of BC Care, BC Care Providers, the VP of that board, and I also a VP of our own organization known as the Hamlets, and we have some locations in BC and Alberta. My main responsibility is HR, even though my title says Chief Operating Officer, Kathy, who organized this from BC Care, thought I would be a good fit for this based on my passion for HR, and yeah, I'm glad to be here. Before we get going, I'd like to acknowledge that we are hosting this meeting on the traditional lands of the Coast Salish people, and extend our appreciation for the opportunity to hold this dialogue here today. As we have people from across the country joining us, if you want to take a moment just to acknowledge your own territory in your chat function, do so. We don't want to take away that opportunity. And please, acknowledge whatever traditional lands that you are hosting or where you are today. We are hosting the technology solutions for health human resource crisis, and we will get to the panelists in a moment. We're excited to have them to share, and we're also excited to have Jessica join us to share her experience with the technology that we're speaking about today. As we're on Zoom, and there are lots of people on this platform, you won't be able to see each other than our smiling faces. And so we would encourage you, if you've got questions, comments, to use the chat function. That's the best way for us to see what's of interest, of things that maybe we didn't cover, and we will have opportunity at the end to answer those questions. We'll get Curtis or Michael to answer or Jessica to answer those questions. And so, yeah, please do use the chat function for that purpose. We also want to thank BookJane for making this event possible. BookJane is a premier partner of our annual conference, the BC Care Conference. And our conference is titled The 3 R's. It is reflection, resilience, and reinvention. And I think our topic today fits very well with all of those, actually, in terms of looking at what hasn't worked, what is working, and what can work going forward. So thank you, BookJane, for being a part of this conversation. Like many, like our organization, probably like Jessica's, we're challenged with workforce challenges, where we've got people that are burnt out, we're short-staffed, and there's of course the impact of COVID on top of that. If it wasn't bad before, it's been made worse by the pandemic. And we have staffing restrictions in many parts of the country, and that creates added pressure. Throughout today's panel discussion, we're going to explore how technology, in particular BookJane, can more effectively be used to mobilize workforce quickly and easily, and make sure that we're connected to our staff, that we retain our staff, they're engaged, and we are consistent in our communication, and ultimately we're providing good resident care. I think really at the core of all this, that's what we're trying to achieve. The panel will provide a real-world example of how powerful the new tool and technology like BookJane can be integrated into your company, into your organization, and can be a possible game changer, particularly when we continue to battle the third wave of COVID. And so on that note, we have 3 panelists that have joined today. First, we have Curtis Kahn. I hope I pronounced your last name right. He's the CEO and founder of BookJane. Curtis has been a business guy and entrepreneur for over 10 years, and he founded BookJane as an innovative platform built to help solve the healthcare labor shortage. Welcome, Curtis.
Thank you.
Secondly, we have Michael Lee, who is Bookjane's VP of Operations. Michael's responsible for the day-to-day operation and plays a key role in advancing the company's strategic initiatives. We welcome Michael.
Thanks a lot for having us.
And lastly, and we'll hear from her just a little bit later, is Jessica Poling. Did I pronounce that right? Yeah. She's the Senior Director of Employee Services with the Seasons Retirement Communities. Jessica is a healthcare professional. She's designated, and she's responsible for the strategic oversight and operations of their HR team. We welcome Jessica.
Thank you.
All right, on that note, thank you all for coming, and we're gonna hand over the presentation to you, Curtis. Actually, Michael, I think you're gonna run the show in terms of the slide deck. And Curtis and Michael, we'll leave it to you to carry on.
I'm going to run the show. Can you guys see the presentation?
Yeah.
Maybe in full view. Okay. Thanks a lot, guys. Yeah, again, thanks for having us with Bookjane. I'm really excited to be able to share some of the things that we've looked at from a technology perspective, and working very closely with Jessica, which is one of our key partners, and really addressing the human resources challenge that we all see today. And I think technology has a big role to play in how we rethink how we approach certain problems. And we know it's a challenge where retention is a challenge. Like burnout is a real challenge that's out there. The last year throughout the pandemic has made it even worse. And we know that human resources is a huge component of running a retirement or senior living facility, and ensuring that our employees are engaged and not burnt out will actually impact operationally to ensure that at the end of the day we're providing proper care to our residents. So these are just some of the things that we've seen as we've developed our product, as we work with customers such as Jessica in there, where we see a lot of workers really just saying, we have to work in multiple places to make ends meet. I wish there was a platform in there that can really create that transparency that's necessary, because when we talk with our retirement homes and facilities that we work with, all of them say they're short staffed. But what's interesting is when you talk to the frontline workers and the staff, their complaints is, I would love to get more hours. And so when you look at that, the problem is really there's an inefficiency that exists between when we reach out to those staff, and a large number of them are going to be part-time and casual, and creating that transparency and creating that trust via technology. And technology can really help mobilize that and really take the burden off of the administration staff and the schedulers and whatnot. So what we see is that traditional methods just isn't sustainable. We know that things happen, things change relatively or very quickly, especially during the pandemic. A lot of the time is being spent on scheduling and ensuring that units or homes are particularly staffed. It's actually starting to leak over to your nursing staff. So I hear that the night nurses is doing call-outs just to make sure there's enough staff that's coming in the morning. And so what that really impacts on is care. So if your night nurses is ensuring that there's adequate people showing up, what they're not doing is providing care, and that actually adds to the burnout, to things that they're not typically, that's not what they signed up for. What they really want to do is go and provide care. And so what Bookjane aims to try to do via technology is take away a lot of the administration burden. And so some other benefits that Bookjane has been able to see is, I mentioned that we're creating that transparency where if there's open work available, it's made available pretty much to everybody within that internal team. Reduces the need for outside agency or even overtime costs. So there's a lot of benefits that we can see by just applying technology in a different way. to make ourselves a little bit more scalable. Just a little bit about BookJane. So, as Hendrik mentioned, we were founded in 2016. Curtis on the call with me founded this because we saw a problem. We saw that there was a problem in the way staff were being deployed, and there was a better way to do things. And today, we work with a workforce scheduling software. We're looking at creating a on-demand marketplace where everything really flows through the BookJane app, and we can make uh, calling out to resources and even scheduling them way more scalable and efficient, all via a mobile app. So some of our key clients on here, Seasons is a very key partner of ours. They came on just at the beginning of the pandemic, and really helped them, I think, rethink. And we'll get to that in the panel version of that. We'd love to hear more from Jessica's perspective on that. But it's just really a different way of thinking about staff deployment. So I'll just get through this because I really want to get to kind of the conversational aspects of it. So some of the key challenges that we solve is really staffing. But two, just beyond just the staffing, we know that staff run the facility. If we make it a better place for them and a better place to work, we're dealing with recruitment challenges that we see, retention issues that we constantly see, that turnover. And we really want to make senior care a better place to work, because all of us are going to get older at some point, and it is an issue that we want to be able to solve like relatively soon. And then the third thing is really implement new staffing approaches that reflect the complexity of the sector. And the pandemic is really taking it to a new level where we really got to rethink the way we work with our staff, work with our residents, and technology is really the solution to do that. So one of the big benefits of technology and transparency and providing that accessibility to work is, at the end of the day, it actually improves resident care, because if you can keep your home staffed and filled with your own internal staff, where, and Jessica will get into some of this when we talk about training, is you can really put your blueprints on it, your fingerprints all over it, in terms of the training aspect, that you're not training and retraining staff over and over again. They're getting the proper repetition and getting familiarity with the end resident care. And that helps prevent, or that helps provide for a high degree of quality of care, provides a better consistency of care where you're building that relationship with the residents. So that is something that BookJane aims to look at all times, because beyond just the technology, what we're trying to do is really solve a problem that's out there, making sure that we're providing, or we're helping senior homes, our customers, provide the best possible resident care by giving the tools for their staff to be able to do that. So quickly go through that in terms of how BookJane works. So from a traditional type scheduling method, it tends to be relatively manual, where a scheduler will create their master schedule, and then things change because life happens. And what they're doing is they're starting to make individual callouts. And sometimes they're using text, sometimes they're using emails. But that process is rigorous. It's a ton of back and forth that happens. More complexity gets added on it when you're talking about a unionized environment where you have to go in a particular order. What BookJane does is, when we look at this, is we just said, hey, there's a better way to do this. We can we can configure in the union rules that has to go out. So if this is the sequence and order that it needs to go out, well, we're just going to program it at once, and the technology will take care of the rest. And so when things change, instead of having to spend hours calling out to your part-time and casual pool, you're just really going into the platform, entering what you need in 10 seconds to say, this is what I require for the next little while. Technology takes care of the rest. It's going through seniority order, it's reaching out to the staff, and it's the full transparency that's needed. Because what's most important is, and I hear this all the time, a lot of times when you do a call out and the staff is not picking up because they're busy doing something else, they effectively miss that opportunity at work. And so having it live on the app allows them to see all available work. And some of the experience that I hear from the homes that I work with is that what they're saying is staff say, I never knew there was this much work that's available. And what you're starting to see, and one of the key metrics that we look at is, before BookChain is implemented into the particular home, what was the average hours worked by a part-time or casual staff, and did it go up? And what we see is those hours go up by at least 25% in terms of staff utilization in that pool. That also addresses is your part-time and casual pool. Those are the ones that tend to turn over the most. And the reason they turn over is because they're not getting at more hours. That directly addresses that. And so that's some of the things that we've been doing and continue to refine. And those are the things that we look at. I'm not going to go over too much about our client successes. I'll let Jessica talk through that, but we've been able to really drive down agency and overtime costs, savings and administrative time, but overall, like just staff engagement and improvement. They love this new way of being able to access work when they have. And so this is what BookChain is aiming to do in technology. And I think I'll pass it back to Hendrik, and then I think we can get to kind of the panelists conversation where we can really talk about some real life experiences that we've seen.
Thanks, Michael. Appreciate the quick look into BookChain. I don't know, Curtis, before we go and talk to Jessica, is there anything further that you wanted to add to what Michael was saying?
No, I think Michael kind of provided a high level overview. I mean, one of the big things that we continue to spend time on as an organization is to try and see how we can work with all the associations and our clients today to solve the labor issue. And that's one of the key components. And the biggest part is, how do we drive retention, employee engagement, reduce turnover, which at the end, Hendrik, you kind of mentioned at the beginning of the call, is really, driving better care for, our clients and facilities, and ensuring that consistency is a big part. And, we're definitely excited to have Jessica on the call to provide feedback. And Michael brought it up, like, we went live with Seasons when wave one just hit. And I remember receiving the call from Jessica to say, we can get you set up right away, and love to hear her feedback in the last 12 months on, how was the rollout, and also how does this really impact Seasons today, and how do they view the world using technology. And I think that's the big part, right? It's not just BookChain providing services to our clients. It's really, embracing technology. And one of the big things for us that we see is, when you're starting to look at retention and utilization of your staff, you really can't use the traditional way of what you've done before. It has to be a change, and you have to really starting to think outside the box, that technology has to be an enabler to help to drive that. We really can't use the things that we did before. We have to really start looking at the future, and we have to really starting to look at to be innovative in, for long-term care retirement homes. Innovation is going to be really key. And technology is going to be a big part of moving forward, especially, life after pandemic. And, I kind of see that, COVID is always going to stay with us. COVID is not going to leave. And we have to have a pandemic plan. We have to utilize platforms to assist the workforce. And one of the big parts too is when you're starting to look at the labor shortage, the workforce is going to look for technology. They're going to look for our clients to have additional technology, because it is something that's going to change ongoing. So we're just excited to get started on the panel.
Great, thanks, Curtis. Jessica, maybe just if you've got a couple opening thoughts that you want to share with the people that are attending this lunch and learn, and then I've got a few questions that I'd like to sort of drill down on. So I'll let you sort of speak to some of your opening thoughts and your experiences.
Yeah, for sure. So thanks again for the introduction and the demo, Michael. Really happy to be a part of this discussion today. It's exceptionally relevant. I think now more than ever as an employer, we're needing to respond quickly to our staffing demands while meeting the needs and wants of our employees. So I can say Season's transition onto BookJane platform and how we've used the platform and how that use has evolved over the last year and a bit really has been our silver lining in this pandemic. I'd say the pandemic really lit a fire under us in terms of thinking differently or more creatively about staffing and schedules. And so the BookJane platform, I think, allowed us to take that thinking and deliver on it quickly. But as we've said, we need to look beyond the pandemic too. And so employers will continue to manage that balancing act between business needs and employee engagement and retention. That in itself, that's a constant, that's ever changing. We know those goalposts are constantly changing. And so BookJane and the platform has remained super responsive to that, to our needs and those changing goalposts. So happy to dive in and share some details around what that looked like through the Seasons lens and our experience with the BookJane platform so far.
All right. Well, thank you, Jessica. I guess selfishly, I want to ask you this question because as Curtis, he's been trying to get our business, and so this is probably a benefit for everybody that's on the Zoom call. Why did you choose them? They're obviously, there's other platforms out there. Maybe they don't do exactly the same thing, but why did you choose BookJane?
For sure. So I met Curtis a couple years ago. We were introduced to the software, introduced to the platform. It's something that Seasons organization became acquainted with and familiar with. A lot of informal discussions, didn't think we were quite ready to take that plunge. And so fast forward to February 2020 wave one, and you've got Seasons deploying a COVID response team made up of key members of our support office who were analyzing, responding to the constant developments in the virus, in the directives, in case counts, you name it. You remember what it was like in those early days with all that unknown. And so, we really took a step back and said, if we can help in any way free up time and make life easier for managers on the front line with regards to staffing and schedules, if we can help those first line of defense employees in any way, it would be a huge miss not to take that opportunity that the BookJane platform was offering and available to us. So I think for us, a decision to use BookJane was definitely initiated by COVID with that mindset of let's try and get ahead of any potential staffing crises and let's utilize a tool we know can take the administrative burden off of our team members. But I think now, speaking from a bit more of a stabilized point of view and I guess what our new norm is shaping up to be, we continue to see those benefits. They continue to be realized and they continue to evolve because BookJane's been a really responsive and innovative partner. It's not just the technology product as it is today. So I would say, yeah, COVID's really how we got our feet wet, but we continue to see those benefits.
And how was it, Jessica? I remember like even before COVID, when we were talking, it was like, let's dip our toe in it, couple of homes. And I think the pandemic happened and we said, let's just do all of them.
Yeah.
And I know you were in the back of your mind, you were a little bit scared. How was that? Like when you think about it, like looking back?
So we were mindful, obviously, that, okay, we're going to introduce a new software in the middle of a pandemic. Is that crazy? Maybe, but again, we knew that there was risk and we knew that we had to act quickly. And so, working with Michael and his team, they were super flexible with how we wanted rollout to look like. And so we did take a phased approach. We did it in waves. Knowing the pilot site that we worked with and how that went smooth, we had an idea of what the mass rollout was going to look like. And so even though we did a mass rollout, we still did a phased approach. So BookJane, being flexible around, okay, we know we want to train one business manager at each community so that we can deploy it quickly, and allow the other managers to focus strategically on their areas during, early days of the pandemic. And we felt super confident that there was at least one subject matter expert at every home. And then we did run, we ran BookJane in parallel alongside more of our traditional methods just to make sure that there were no gaps. But within 3 to 4 weeks, we had the enrollment rates that we knew we could pull the plug. We changed our policies and moved solely onto a BookJane platform. So since then, we've deployed it to general managers, and now we've deployed it to all managers in the community who have experience and exposure and access to that. And I know BookJane's been adaptive to that phased approach and made it really accessible through a single user sign-on. And so it's super inclusive to every manager in the community because they're all seeing the same information. It really has, I think, from a communication standpoint and an awareness, brought everyone together, and it's been super inclusive from a communication standpoint.
So using this technology, I mean, you talked about deployment and you took the phased approach, which I can totally understand. I guess my question would be, was there resistance? I mean, it is change. We talked, earlier, Jessica, we talked about change, and was there resistance to moving from a traditional way of doing things to, obviously a technology base?
Well, I think we need to be realistic and honest when thinking about new technology or technology change, or, let's face it, with some people, change of any sort. And so as a company, I know Seasons has always prided ourselves on, remaining nimble and being able to change course.
Mm-hmm.
But of course, you're always going to have resistance with certain team members. I think it's less about is there or was there resistance, and really knowing your audience and your operations and understanding in advance, where do you think that resistance is going to come from, so you can proactively change the conversation and know where to support the gaps that you anticipate. And so I can say BookJane really did act as a partner in mitigating that resistance even before the rollout, along with, of course, the buy-in of our internal senior operations team. So thinking about the resistance we saw, I think you can put it in 2 buckets. So one, the managers that were going to be responsible for rolling this out on site, knowing which ones of those are typically in general less open to change anyways. The ones that just want to do it their own way. We all have those types of people in our organizations. And so getting that list ready in advance. And the second bucket, frontline employees who maybe don't really embrace technology or maybe don't own or have access to smartphones. So if you talk about and you look at the first category we talked about of those managers' resistance to change, really having buy-in from your senior operations to help drive the rollout, but mostly just being able to help them see what is in it for them. Why is this a benefit to them? We found that to be the most impactful, and I think BookJane's training rollout is super straightforward. It's customized, and it played a huge part in, I think, alleviating those anxieties for those who were maybe hesitant or a little less trusting in the process. And so once you really see it and you go through that training with the actual BookJane team, they're not passing you a manual. It was very hands-on, very service-oriented, and it was tailored and custom to our needs. I think we had a really big shift in that paradigm. And then the second category, when we talk about frontline employees, maybe not having access to smartphones or not really being that open to technology or embracing technology, we did a pulse beforehand. So really understanding how many employees are we really talking about that fit into that category before we pulled the trigger on this. So as simple as knowing which employees do you know you need to spend a little bit more one-on-one time with just to get them comfortable and familiar, and having access to some of those smart devices on site if possible as well. The Book Jane pre-launch communications and the enrollment process is super straightforward, and it was really impactful because the message wasn't coming from Seasons, the message was coming from Book Jane, and sometimes that third-party communication goes a long way, especially when it's short, sweet, straight to the point. And I think really, if it's easy and they can see what's in it for me, those were the two most impactful components of Book Jane's partnership in the rollout.
I think I'll add that, Jesse, you guys were super, and like even before we went in, we knew exactly which homes were gonna adopt this, and we worked with them. We made the homes become our biggest champions, and Book Jane came in and we said, here are the things that you're gonna see. Where we all know this. There's certain frontline users that are gonna be a little bit abrasive to technology, but it's really just about listening to them and just listening. Okay, what are their concerns? And really saying, this could be a better way for doing this, where they hear, what if I miss my phone? What if I missed my notification? And it's just that change management that needs to happen. And, that made it easier for us. So we were able to prep. I think Welland was one of the early adopters. We said, here are the questions that you're going to ask, and here's how we need to address them, and here's how you can show them. And it all takes like 30 seconds. And when they see a new way of doing it, most people look, yeah, you're right. That is a better way of doing things. And I think that, honestly, that helped a lot for us, knowing what we were going up against and understanding, okay, here's some of the challenges. And then, we were able to provide our lens to say, here's a common question that you're asking. Here's typically how we would address them.
I will always remember this one business manager in particular was literally in actual tears out of fear that she had to make a change. And this is a high performing business manager. And I remember her laughing at the end of it saying, oh my gosh, that was so easy. This is so much better. I don't know why I was so scared. So we definitely saw, everything across the board, from people who were excited to those that were literally in tears, and watched the paradigm shift. So yeah, really fun to see when you garner the confidence and they have the trust after just going through the process.
So just a follow-up question, because often this can be a source of resistance, and I don't know, Jessica, if some of your sites are unionized. In BC, a lot of homes are, and probably throughout the country, there's a lot of homes that are on this call. How did you sort of convince the unions to get on side? Because there's always a fear of, that the whole seniority thing gets messed up, and people don't get their fair shake at shifts and vacation coverages and all that sort of stuff. And so how did that process go, and how did you get them on side?
Honestly, the union response, in a nutshell, has ranged from curious to neutral to actually very positive. We've had 0 grievances related to the rollout or ongoing usage of the system. This conversation is really no different than having that proactive plan and conversation with the employees are going to be resistant to change. So having in-depth, positive, proactive conversations with your union so that there are no surprises. They feel that they've been a part of the conversation, and at the end of the day, they just want to know that they're able to support their members and answer the questions of their members. And so those early day conversations went a long way. The seniority and I guess compliant functionalities in Book Jane make it super easy to comply with your company policies. With your CBAs, there is a really flexible ranking feature in BookJane. And so everything from, ranking seniority, whether it's by hours worked, whether it's by date of hire, whether it's by department or overall home seniority, there's different ways to use that ranking feature. It's super flexible. There's also an additional layer on there that if you've got employees that are cross-trained in different departments, they too can be added to a primary ranking list, and then they can also be offered shifts in other departments after it's gone through the rest of the primary workers in that home department. So yeah, the ranking feature is flexible, and you can customize it based on your collective agreement or your policies.
I think
I'm
the
gonna
cool
just
thing.
gonna add one more to that too. Within the platform, there's an audit trail as well, where it will show you that the jobs went through, people based on seniority. So there's a full audit trail. And one of the things that we've seen too across the country, the unions that Jessica mentioned have embraced it because we're providing more hours to their workforce than utilizing third-party agencies, and that's been a big part. Where could we provide more hours to the workforce?
Yeah. And at the end of the day, they just want to make sure you're doing it in the right way. And the system absolutely allows you to do that. And to Curtis's point on the audit trail, that's a really, really good feature to use as part of your proactive conversations. Because if you can take that and say, let me actually show you what it looks like, you're just garnering more confidence both in the union as well as your staff.
Well, yeah, there's nothing worse than somebody saying they missed a shift, and then you can go, well, wait a minute, actually, here's how it went down, and actually you didn't. You actually you were called or you were offered the shift and you missed it or whatever. I mean, that's often what the complaint is, right? And if you can alleviate that by proof, I mean that definitely changes the conversation. Michael, you want to add something?
It also opens up the conversation, I think. So, as I've been working with a lot more unions, it's like even pre-launch, we sit in front of them. We say, here's how it works, and they become a part of the conversation. They see that it's transparent. They see that there is that audit trail where we can see, and if it misses something, well, we can work through that. And it's really building that trust and that relationship between the home and the union itself. And at the end of the day, what this is really focused on is what they're trying to do, aligning our interests and providing more access to hours to their own membership base, which they like, right? They say, okay, this is a tool that can help my membership. And this is also helping the homes themselves because it's giving that consistency, getting back to the quality of care. I think that's what we're trying to do.
Yeah,
Perfect.
absolutely.
I'm curious. It's been a year and a bit for you, Jessica, in terms of rolling this out across your sites. If we were to ask your team now, particularly your frontline team members, what would they say about the app? What would they say? Has it been a good thing, bad thing, a neutral thing?
Yeah, I think the first key indicator to look at there is your enrollment rate. So who's actually using the platform? And if I look at that progressive story from the time we launched, within the first 7 days, we had a 28% enrollment rate. That jumped to 70% after just 4 weeks. I think, between Seasons and the BookJane team, we were thrilled with that quick adoption rate. And now we are sitting stabilized anywhere between an 89 to 93% enrollment rate. And so we've solicited feedback both informally as well as through formal pulse surveys. Frontline specifically, I can tell you that they love that they are not getting constant phone calls from their managers multiple times a day.
Yeah.
They have the autonomy to pick their own shifts, to do it on their own time, on their own app, on their own phone. I hear staff saying I check multiple times a day to see what's on there. So they're engaged with that.
Mm-hmm.
I've also heard staff are wanting to pick up additional shifts because they're not being asked to. They have the autonomy, and they, you're seeing a shift from that sense of obligation, and now it's starting to come from a place of desire, commitment, and choice. And I think choice has been one of the most impactful components to this transition. And so I think that's huge when we talk about shifts being available, and managers not having to scramble and give out incentives just to have someone show up, and getting people to actually want to work and doing it on their own. That's massive.
Yeah, I love that comment about providing people choice, because the choice of work-life balance is in their hands, not in their employer putting pressure on them. And I think you're quite right. They're more apt to give up more of their personal time if they can do it where they're controlling what their work schedule is, more so than the employer kind of, like I said, putting a lot of pressure on them. So thank you for that comment. That is so true. I guess a sort of follow-up question is, what has been the impact on residents, on resident care? Have you noticed an impact?
For sure, and I think that's one of the biggest outcomes and goals that anyone would look for out of a system like this. And I think where you see the positive impact to care is when it is our own team members that are delivering that care, because those team members have been specifically hired and hand selected for their propensity for customer service, and they are familiar with and they align with the season's mission, vision, and values. So Book Jane having that platform that allows our team members to be the first ones to quickly and easily see those opportunities and pick those shifts up to ensure that their residents and their coworkers have the right support throughout the day. That's absolutely where you see the impact to care delivery and service delivery to the residents.
Okay. Now talking about the money side of things, you take where you were, which is a very, was a traditional scheduling system, which many of us probably still use. What did you experience in terms of cost savings going from that traditional service now to an app-based or technology-based scheduling?
I think the easy one is your cost savings in time for your administrative managers. If you look back at Michael's diagram that he had in the traditional method versus the Book Jane method, I mean, that's a no-brainer. That's not theoretical. That's absolutely applied practice when you look at the difference between multiple phone calls that are often unanswered, multiple texts back and forth, and then having to manually make sure that you're in compliant with your policies and your collective agreements, versus the ease of posting a shift online and someone can pick it up with the click of the button, and you have the confidence that you're already compliant with your overtime thresholds and your collective agreements in terms of seniority and shift offerings. So a big one there in terms of overtime is, and when we go back to that ranking and seniority feature, you can rank employees in a way that you are not offering full-time employees those shifts that would put them in an overtime position until it's gone through your part-time and your casual. You can block them entirely if you wish, or if you want to go through your entire roster first and then offer it last. So there's a control measure there that we've seen to be quite impactful. And then, to quantify that administrative and time savings, of course, it depends on the size of your home, the size of, your occupancy levels and the size of your staff roster and how many vacancies and shift vacancies that are going out. But it would not by any means be a stretch to say that you're saving a day per week collectively in some of your medium-sized homes or larger homes with vacancies and shifts that need to go out, especially when we're talking about quick vacancies if someone has to get tested or is deemed a close contact. So there's those savings on a regular day, but especially with the pandemic, when things can change on a dime, you need to be able to respond super quickly, which obviously this has allowed. In fairness, this is not a regular year, so it's pretty difficult to benchmark against other years when we're talking agency and when we're talking overtime, especially understanding nurse shortages right now. But now that we're starting to get back into that stabilized atmosphere, we have the infrastructure that BookJane has built out, so we can benchmark that ROI in addition to the efficiencies and those engagement levels that we've already seen.
Jessica, are you able to speak a little bit about agency utilization?
Yeah, I was going to ask, that was my follow-up question too.
In what capacity, Curtis?
Either reduction or your spend, has your spend increased or decreased?
Yeah, so this is where we can see a lot of different stories. So has agency reduced in some capacity? Absolutely. Hands down, no questions asked, because you are utilizing your team members first who maybe otherwise were not getting offered those shifts, or it wasn't making it down the chain. But again, this is not a regular year. So we've seen some pretty incredible anomalies in terms of staffing and crisis management. And so that's why I say, in fairness, this is not a regular year. And in some levels, we have had emergency agency staff needed for our RPNs, for example. But that's where I say we've got the infrastructure to benchmark that when we stabilize, because I think measuring that in the middle of 2 and 3 pandemic waves doesn't necessarily give you a consistent story, but we absolutely know that we've got less shifts that go unfilled, and it's going to all of our team members first.
I think you touched on this, the equal distribution, where you're not going back to the same person over, that leads to burnout. And it also, the distribution across your entire staffing pool, where not one person's picking up all the shift, it helps equalize it. And now, the person who feels like they're getting ignored all the time is now saying, oh, I have that shift, and that wanting to come into seasons to work is a real thing to able to provide better care.
So that's where you see your overtime metrics decline, because there's a control in the system that won't even offer it to someone that's going in overtime if you choose not to offer it to them. And then you also have that equal distribution component. And, as a result, you've got engagement of staff not looking for other jobs because they're getting hours that they maybe would not have otherwise been offered.
Right. Okay. There's a couple questions in the chat box. The first one I'm kind of interested in, this is probably a question for Curtis and Michael. Are you currently working with any LTC sites in BC?
We have a few in BC. Jessica, I think it's in Alberta. We're across the country. We work with several sites in BC. Some on the island as well. That one's a typically challenging geographic to get into, but we're working in there as well.
Okay. And then the other question, I think, Michael, you answered, and it would be a question I had, is the platform more geared towards short call or those last minute calls, or can it be used for all scheduling?
It can be all used for all scheduling. And so when we looked at the platform, and what we saw was the biggest, problem that wants to be solved. There's many software out there that's dealing with scheduling, and which is really your master schedule. That component is actually easy, right? You can really predict out what you want to happen for the next 6 to 8 weeks and whatever. So we do that. But where BookJane differs from a lot of platform is the day-to-day changes that happen, is when you have to react quickly. You don't have a mechanism to do it. This is where BookJane really thrives, and that's really our call mechanism, and where we differentiate from a lot of other scheduling software that's out there, because that's the major challenge, to be able to do that, to be able to provide more hours for your team, the engagement, etc. That's what we can do, but we can do both.
Michael, am I able to speak to the API piece? Because I know there's a question about payroll and time and attendance.
Absolutely, yeah.
So just going off of Michael's scheduling component, I know we've been, partnering with BookJane on looking at how do we create more efficiencies from a time and attendance and payroll standpoint. And so they actually helped us bridge the gap in terms of creating sort of what's like a push. So anyone that has a shift scheduled or picks up a shift on BookJane, it's automatically going to be pushing into our time and attendance system. So that's going to feed your payroll, and that's going to eliminate any manual scheduling work that your administrators are doing with respect to entering shifts into a system that pays them out.
Yeah, so for us, like BookJane is constantly looking at, the next that's one of the next problems that we looked at. It's like payroll takes us a really long time, and we're like, okay, let's work through that. And I know I'm working with some other homes, and they're saying there's payroll Tuesday, where that's all they do for Tuesdays is they work through payroll every other Tuesday. And so we sat down with the seasons team and really work through their payroll partner. But that's the cool thing about technology. When everything's going through technology, is we can actually do that, and we can integrate with many different software platforms to make it a lot easier. And that's absolutely something we're looking at for our product roadmap. And some of it has already been done.
Yeah, and there was a question in the chat box that Curtis answered in regards to, does it integrate with other payroll systems? Comvita is a big one in BC in terms of software. And I'm assuming that it would sort of plug into its EMS side of it. And then from EMS, as Michael was saying, we go over to the payroll. Is that how it kind of rolls in a lot of these softwares?
Yeah.
Yeah, okay. Just checking the chat box there. All right, well, we're coming to the end of our time. So I want to just give an opportunity just to maybe Michael or Curtis, any last words, and maybe Jessica, I don't know if you have any last words, but sort of close up the lunch and learn, respecting time people have committed to this. And but yeah, so Michael, Curtis, anything from you in sort of closing remarks?
Sure. Again, thanks for everyone for attending, and thanks for having us on the call today. As Jessica mentioned, we are here to help our clients today. Long-term care, retirement homes. We're currently working with some of the public health clinics right now to help on mobilizing the rollout of the vaccine. So there's a number of things that we're doing, and one of the things that kind of stands out. Yes, we're a startup, but we are innovative. We are a key partner. Recently, we just won an award for customers service levels, and that's something that we're extremely proud of because our team is pretty much entrenched with the organization. So that's one of the key things I would say. And again, we're looking forward. If anyone has questions, just reach out to us. I'll put my contact on the chat here as well. But again, really appreciate the time. And again, we are here to support our homes, especially during this crisis. And one of the big things I kind of see too is, there is life after COVID, but how are we going to manage the next pandemic, which is the labor shortage? And that's a big part. And one of the things that, in order to manage this again, is technology is going to be an enabler, and technology is going to be a key component to this. But again, thanks again.
Yeah, and I can mirror those sentiments. I mean, our experience has, of course, been positive. I think beyond the system capabilities and the functionality, if you pair that with the BookJane partnership, which does offer really a boutique partnership, and it's not that big box, one size fits all, that's been the biggest positive and the biggest win for us, is that they've continued to create and innovate and provide service specifically to our needs. So that's been, the greatest sentiment that I can advocate for in this conversation. So thank you.
On Note, I just want to thank you, Jessica, Curtis, Michael, for being on this panel. It's been awesome to have you. And again, I want to thank Curtis, you and your team for being a sponsor at our upcoming conference. The 3 R's: reflection, resilience, and reinvention. It's great partners like you that make conferences a go, and we appreciate that. And I want to appreciate everybody that took part in this session. We have lots of people that have, you can see them on the participant list there participating, and some good questions. So, and if you're interested in joining our virtual conference, those online, please look at BC Care's website. There's a easy way to register. You register before April 30th. You get an early bird special. So it's going to be a great conference, great speakers. And it's usually a good time to network with people as well. And I want to wish everybody, the panels, everybody on this call, a great day, and stay safe, everybody. Take care.
Thanks, everyone.
Thanks, everybody.
Bye.